clear things up a bit. This is a great blooper reel. This is going to be one of the hardest videos in the series. If you are new here, if you don't know what this is a journey, a live documentation, updated regularly, of trying to prove medical history. We are trying to investigate whether it is possible to fix a broken back without invasive surgery. There is evidence online, some published case studies that says, yes, it's possible, but I'm the first person to volunteer themselves to actually document and videotape the whole thing. Specific type of broken back, so something called Spondylolisthesis, which means that a portion of your back, your vertebra, have slipped, generally in the forward direction or in the reverse direction. So we have our sacrum here, and then our L5, the lumbar fifth vertebra. And in the case of spondylolisthesis, there's movement of this forward. This is a surprisingly common injury that generally happens because the back structure of the vertebra, which hold them in place and prevent them from shifting, break or never form fully in your adolescence. In my case, I'm pretty certain that I broke it during a fall down some stairs, but like most people in their 20s, I didn't think much of it other than my butt hurts and I have some bruising. And many years later, I discovered that I have very severe slippage. So if you're watching this video because you have this condition or a loved one has this condition and you're wondering if this treatment can work for you, I still believe that there's plenty of evidence to say that it may work for you. We are technically 6 weeks into the traction therapy method. I've had some questions as to what this is. This was a method invented by a chiropractor who is currently based in Georgia named Curtis Fedorchuk, in which he places a patient on a very specific table, which allows them to be essentially strapped in place, and then very specific movements sit you down on the table and shift things because you are strapped in place, actually using real-time imaging, a form of X-ray called DMX. And I had this type of imaging conducted on me by Dr. Fedorchuk in order to determine, is there even mobility in the correct direction? And that was successful. We saw mobility. And so I was referred out to a practitioner that's local to me to replicate that. Here's the issue. 6 weeks in was not what we wanted. We are slightly continuing to reverse, but at a rate that is so low that the local provider and myself feel that it is necessary now to go back to Georgia for the big guns, the guy who invented it, because my case is so advanced, it doesn't feel like we can make local progress anymore. Now, this isn't hopeless to me. I think there's 3 main reasons why we stopped seeing the same degree of reversal that we saw in those first 3 weeks. One, primarily, my condition is so advanced that my disc, which normally would sit between the sacrum and the L5, is actually squished. If you see here, my slip was so severe that my disc, which should be between the sacrum and the vertebra, has actually been shifted. It's in 2 pieces currently, here and here. And so I believe part of the issue that we're facing with my local provider is as we attempt to pull these apart and push them together, we can't fit the disc in there because in order to adequately create enough space, we would have to pull a significant amount of traction to essentially squeeze that disc back to where it belongs. Reason number 2, I had a lot of scoliosis in my lumbar spine when we first started, and a large amount of that has actually reduced. So if you think of it like a chain where you have some curvature, if you try to pull a chain taut, if you had already a little bit of some slack in the chain, when you pull it, like these tables do, the first thing that's going to happen is you're just going to pull out that slack. And so you can think of my scoliosis in a similar fashion. If we're trying to separate the chains being the vertebra and the sacrum, well, first when we pull out that slack, the scoliosis, we're not actually able to create as much force to separate those vertebrae. And so I do believe that perhaps had we even gone a little bit further, a few more weeks into treatment, because the scoliosis is almost gone now, we probably could have created more separation to squeeze that disc back into place. But the third reason, and I think this is probably the most relevant reason, is my local guy doesn't have real-time imaging. He's not putting me on a table and looking to see precisely what happens at the bone level when he's applying that traction. He just doesn't have that imagery. That's what Dr. Fedorchuk in Georgia has. And so we can't really do any guesswork at this point with my condition being as severe as it is. And so I'm now in some ways at the mercy of Dr. Fedorchuk and his clinic in Georgia to go and do some intensive visits where they can really see exactly what's happening. And hopefully, just like we did the first time I visited, slide that disc right back into place and then retain that stability in order to allow us to then begin sliding everything back into place. And I know how powerless this can feel to know you have a problem, think that there might be a cure, and just having to wait for, in this case, probably the one person that might be able to help you in the best possible way. It doesn't feel good, I'm gonna be honest. To Dr. Fedorchuk's defense, he has been extremely helpful and kind and supportive and communicative throughout this whole process, supervising my treatment at the local clinic. So I feel bad even having to go back to him, but at this point, we're at a crossroads. I can't get secondhand support, I need the expert. But being able to update all of you, share this journey alongside you, hopefully change the precedent for not only the insurance requirements, because damn insurance, you need to be paying for this, but also to say there is an alternative to surgery. That's what the case studies, that's what the literature told me, and to be able to document this and hopefully bring a completely alternative method, perhaps a safer and better long-term method for everybody else that might face this issue at some point along their lives. So you all give me a lot of motivation and hope to continue to go through this. It's tiring, it's exhausting, it's scary, and it sucks living with this condition. But I've had so much hope in how much my symptoms have been alleviated, in the fact that we've seen some reversal of the condition, doing what doctors told me was impossible. And so now, Dr. Fedorchuk, I hope that you get back to me soon and we can go ahead and schedule some intensive treatments, because I'm ready to get back to having a healthy back. And I think that's what anybody would want.